Awesome. Let's see. I think it's telling us that we are live. Hey, everybody, as we coming on, let us know that you are here. If you would just put your name in the chat box, we're going to wait a few minutes before we get started. Let's all go find our platforms.
Yes.
I know I got a Facebook page around here somewhere. I'm excited about what we're going to be talking about today. I see us aligned. Hello, everybody. Thank you for joining in with us. We're going to wait a few more minutes. Super excited. I'm super excited for everybody that reached out to me through my inbox. So listen, we do want you to share. We're going to be talking about postpartum on today. In a few minutes, I am going to introduce everybody. I need somebody that's hearing us live to give me a thumbs up, to let me know that you can hear me loud and clear. Let me know that you can hear me loud and clear. Let me know that you can hear us loud and clear. All right. And as you come on, if you would like for us to give a shout out to you, please let us see your name or just put your name in there as you come on. So we're going to wait a few minutes before I introduce these wonderful therapists that we have here. So I'm going to ask everybody that's here and present with us, that's actually in what we call our studio. Thank you for sharing us on your Facebook page. Let's share, make sure we've shared on my TikTok page.
Yes.
But if you're in our audience, and again, we do appreciate that you guys are sharing, but if you would take your mute button and put us down mute so we won't get any feedback. All right. So I see everybody that's coming up. Lord, give us say glory to God. I'm in the council in my church. Man, you can't take the church out of me. You definitely can't. I need somebody to check my TikTok page to make sure I'm going live on my TikTok page. I believe Miss Nadia is going to do that. So super excited. I'm so super excited that my baby sis is here with me. Awesome. She's present with me. Awesome. I mean, there was nothing like having a sister. Right?
Yes.
Nothing like having a sister. And how many know that you can have another sister from another mother?
Yes, you can.
And you can have another sister from another mother. And I truly thank God for her, because truly she is that sister from another mother that truly loves me. You love me? I love you. The audience didn't hear that. You love me? I love you. You love me?
Yes, we love you too.
Awesome,
of course.
Awesome.
You know,
again, thank everybody that's coming up on us live. Wanted to just tell you thank you. We do see you. Listen, y'all, I'm trying to look at my page at the same time to make sure that I'm acknowledging everyone that is coming on. Well, see, I just told y'all not to do it, and I messed around and did it. So I'm going to turn mine over to somebody else. See, that's what you do when you don't know how to do it, right?
We got you.
I had to cut myself down.
We got you.
All right. So can y'all let me know if y'all can still hear me? Hear us loud and clear. Can you guys give us a thumbs up? We want to make sure that everybody can hear us before we go live. So if someone could just say we can hear you.
Yes.
I see my cousin up there, Tanisha. Tish, let me know if you can hear me. That is my cousin. I love her tremendously. Teacher Pro, I do see you. Hello. Definitely see you on live with us. I'm waiting on my cousin to tell Kayvon, my sweetheart, let us know that we can hear you. He says definitely needs some guidance on I'm working, Mom. All right, as long as you're working, that's all right. But Kayvon is one that, we're coming after you. He's also one of the ones that we're going to have at our mental health conference.
Yes,
they will be reaching out to you. I love him tremendously. So we will be reaching out to this great man of God, and also a great therapist in his right as well. So I'm excited about that. My cousins are telling me that she hears me. Tanisha, Beth, love you tremendously. I do see a Shirley.
Rochelle. Hey, Rochelle.
You see her? Come on, shout out to
Rochelle.
That's our girl.
All right, listen, guys, I got contacts on her for some reason. I'm still leaning over. Ain't nothing wrong with leaning over.
No,
Nothing
nothing at all.
Okay, guys, again, so thank you guys for joining us tremendously. So today is what we call talk therapy. We're going to be very relaxed in it. We definitely want to share. And if you have a question that you don't want to put it out there, please privately inbox me, Brenda Ward, and I would definitely ask that question for you. So you can definitely do that. So I am watching that at the same time. Or you can text your message to me at 757-571-9190. That is my private work number. So if you have a question, even if you come back later and listen to the live later and you have a question, we would do our best to get the answer if we don't know the answer, but we would definitely acknowledge your question. So again, send it to my work cell, 757
571-9190.
Oh, y'all know my number.
You can read.
You know my number. So let me just give a shout out to these great therapists. Again, we send our love to you for Virginia Therapy Services. I do want to give a shout out right now to one of our therapists who is very much involved in what we're doing. But today she's home on maternity leave. So how many of y'all remember Tiffany Johnson?
Yes.
Hey, girl.
And RJ.
I don't know if she's on there. But she is very much part of who we are.
Yes.
But she's on maternity leave. Other than that, she would have been sitting right here on this platform with her. So we truly want to say hello to her and hello to her family at the same time. So let's begin. For those who don't know me, or you probably know me as Pretty Girl Apostle, I am a licensed professional counselor in the state of Virginia. I got multiple things. I am a CSAC. I can do substance abuse at the same time. So and not only that, I am a licensed professional or licensed pastoral counselor. And I am currently working on my PhD. Give me some time.
Yes.
I'm currently working on my PhD in forensic psychology.
Come on.
Am I saying the right
Yes,
thing?
you are.
Yes.
Because I want to be the one to go to court with you.
Mhm.
I want to be the one to go and help them understand some of the challenges that people are going through with their diagnoses. So you'll be seeing me graduate real soon in reference to that with our PhD. All right?
Yes.
All right. So I'm
Another
going to go
doctor.
down the line, but I'm going to start off to my left, and I'm going to start off with Miss Dana Leaphart. Come on, raise your hand, Dana, so they can see you.
This is me.
And I'm going to let her introduce herself. Great counselor in her right. Very knowledgeable. I love the work that she does. I love the heart that she has towards the people. So Dana, come on and tell them who you are.
Well, I'm Dana Leaphart.
You louder?
I'm Dana Leaphart, and I am a licensed clinical social worker eligible. I take my test next month.
Woo!
Yes.
And I have had the opportunity of working with children and specializing in
We
play
love it.
therapy, children who have been sexually assaulted. Also do couples therapy and individual therapy. So I have a wide variety of specialties that I am able to treat.
And does very well with that. Does
Thank
very
you.
well. So let's give a shout out for Dr. DeLandro.
Yay!
Dr. DeLandro, and you guys, please feel free to turn the mic towards you. I do need you guys to speak up a little louder in the mic. And just tell people who you are with some confidence.
Absolutely. My name is Dr. April DeLandro, the CEO of Del Sol Association, specializing in services for people with developmental disabilities. However, I am almost close to becoming a licensed clinical social worker as well, because I do have interest in assisting adolescents and also working with people that have experienced trauma of some sorts. So a lot of research and desire in helping others, but specifically adolescents at this time.
Awesome. So come on, let's give it to the pretty girl in pink.
Yes.
Awesome. I like to tell people in my right hand that knows pretty much almost know my job is better than I know it. She don't know it better than me yet. Y'all don't get it twisted. But she's getting there. She's running. She tracking me. And so let me just let you know who this is, and then she's gonna tell us who she is, right? So what's your name?
I am Ashley.
Go ahead, Miss Ashley.
I am Ashley. I am a LPCR.
Yes.
I will be taking my test in July.
Yes.
I am also a multisystematic therapist,
Yes.
also known as MST.
Mhm.
I specialize in children and adolescents and adults as well.
Awesome. And very good at it.
Amazing
Very
at
good
it.
at that.
Yes.
She does really well with your children. So if you know anybody that, kind of challenging, having some challenges with their children, with their behavior, I'm telling you, Ashley is the way. I've seen her do phenomenal, and I've seen kids' lives change. Not only just your kids' life, but I've seen their family as changed as well. All right, so let's put it together for our next person, who's also VTS right hand therapist. Now she's a therapist in training, right? Also, our administrator does a wonderful job. Peer recovery specialist.
Yes.
So let Miss Anyette Foster tell us a little bit about herself.
My name is Anyette Foster first. Let me start there.
First.
And I am a peer recovery specialist working with adults. And I am also a life coach and working with adults and just, encouraging people and just inspiring people to be the best self that they can be.
Awesome. Yeah. So we do see you guys going up. So you guys can see that screen better than I can see the screen. Anybody new on there we want to give a shout out to?
We see a Mona Patrick.
Oh, Ramona. Oh, that's my bestie, y'all.
Hello, Maika.
Hey, Maika. How are you? Well, guys, I guess we're ready just to kind of dive into. And so as you guys see people come up that know you, let's just give a shout out to them because we want you to know we truly thank you for coming on with us on today. So we do appreciate that. And we are hoping that you're going to get something today that you're going to be the eye that help yourself, help someone in your family, help your neighbor, help somebody at your church, or just be there to help someone. So today our topic we're going to talk about is called postpartum depression. We're going to talk about postpartum depression. Now, we will be back, most likely we'll be back once a month, talking about different mental disorders. So if you have one that you want us to come in and talk about on Talk Therapy, just let us know. I did get one that they want us to come back and talk about is narcissism, right? I'm like, ooh. So we're going to come back and we're going to talk about that. So we ain't going to touch that right now. That one right there.
We need about a week for that.
We need about 2 or 3 days.
Oh my goodness.
The narcissism. But today we're going to talk about postpartum depression. We definitely want to talk about that today because I have discovered that not many women realize that they have tapped into postpartum depression. And sometimes, right, they blame themselves. They don't understand what they're going through. They don't understand what they're feeling. No one ever told them about that. So before I turn it over to the panel, let me just kind of explain to you a little bit. What is postpartum depression? And so I'm going to share this. And then anyone on the panel, if you want to open up and add some more to that, you're more than welcome. So postpartum depression, also known as PPD, right? It is a medical condition that many women get after having a baby. But I have discovered that they can have postpartum depression even before they have the baby.
Yes. That's called prenatal.
Say it one more time.
That is called prenatal.
That's called prenatal
depression.
So you can actually go into that. So as I read this, I do want you to understand that it can start happening right during your pregnancy. All right. And I definitely want you to talk about that in a few minutes, Dr. April. So again, postpartum is a medical condition that many women get after having a baby or prenatal.
Yes, ma'am.
Right? It is a strong feeling of sadness.
Yes, it is.
And we're not going to rush because we definitely want to get this. It's a strong feeling of sadness. You got a mixture of anxiety, a mixture of worry, and it's tiresome. And it lasts for a long time after having a baby, right? And so I'm just going to begin to open that up with you guys because a lot of people think that right after you have your baby, 3 months later, 6 months later, that it'll be over. But we have found in our field that is not so. So Dr. April, you talked about prenatal. So take us into that really quick.
Absolutely.
A little louder, though.
Absolutely. So what happens with postpartum depression, it is also labeled in the medical field as the 4th trimester. So you think that after you give birth, that's it, I've had the baby, but your body is still going through changes. So
Right.
there is a science behind it.
That's good.
That there's also that hormonal imbalance that can also come.
Yes.
So never feel guilty for what your body is doing naturally.
That's
And that's
good.
another way that your mind is responding to it. So it's called the 4th trimester, and it can also begin symptoms for postpartum depression begin prenatally, meaning as soon as you find out you're pregnant, you can begin to display
Wow.
symptoms.
Wow.
Yes, there is a higher likelihood of experiencing postpartum depression if you've struggled with depressive symptoms before getting pregnant.
Can you say that one more time?
Yes, there is an increased likelihood of experiencing postpartum depression if you've struggled with depressive symptoms before getting pregnant.
Mhm.
And so, of course, typically someone can carry that into pregnancy, and it does affect the fetus. I'll get into that later. But yes, it's also known as the 4th trimester.
Awesome. So, Ms. Dana, anything you want to add to that?
Well, what I wanted to add is that
Take your mic.
it also happens in men. I
Yes,
don't
it
know
does.
if many people know
I need
that.
you to say that really loud because that was powerful.
Men also experience this phenomenon. It is called paternal postnatal depression for them.
So right there, if you just heard what she said, let me see you put that on the screen because she just said something so extremely powerful, right? I'm going to have her say that one more time, and I'm going to have you just say that a little loud because I want to make sure everybody hear that. That is powerful.
Yes. And a lot of people don't know that men also suffer from this depression phenomenon after the child is born.
Wow.
It's called paternal postnatal depression, but it's very
I love
similar. It manifests a little bit differently in men than
Okay.
it does in women.
Take us there.
You talked about the manifestation in
Yeah.
women. For men, the top symptom and sign is anger.
Wow.
Anger, violence, angry outburst, irritability, also an increase in risk-taking behavior.
Wow.
That's good.
You'll see substance abuse, impulsiveness. You'll see challenges in functioning, anxiety, irritability.
Wow.
Yes. So men don't do the crying and the outward expression
wow.
of emotion.
Yes, ma'am.
So that's how, but it's still the depression.
Yes.
And they're more likely to get it
Yes.
if the woman is suffering from it. Isn't that interesting?
Wow.
Yeah, so
That
if
is
she's
good.
suffering from postpartum depression, there's a higher likelihood that he will suffer as well.
Wow.
Yes.
Wow. Go for it.
I was gonna say one more key element. It doesn't have to be the biological father.
Right.
That's right.
It's the
Oh, my
father and the
goodness,
father in the
yes.
household.
Yes.
Yes.
So yeah, that's a big. Thank you for mentioning that.
Mhm.
Did you guys get that? Wasn't that powerful? I see Monica saying, "Oh wow, Monica is my spiritual daughter. Way in Michigan. God bless you. Love you tremendously. Love her definitely tremendously." I think that was really powerful, and I love the fact how you guys brought the men in,
Yes.
and how we can't forget the fathers.
That's right.
That is so powerful. So let us know definitely if you have that, and if you guys got that, and if you guys want to hear a little bit more on that in reference to that. So anyone here have anything you want to share? Because I think that was powerful.
Yeah, that's good.
Go for it. So let me ask a question, right? And one can do for the women, and one can do for the men. If I see the sister, my significant other, who's a male experiencing that, what can I do to help him?
You want to do the mail? Go ahead.
Ask for help. It's that simple. Just ask for help. If you begin to recognize symptoms, and it doesn't have to be, oh my goodness, like Dana mentioned, crying episodes, because it looks different in men.
Mhm.
So for men and for women, if you recognize it in each other, simply ask for help. We have the
Wow.
number on the screen right now, because if you continue to dwell in it and
It
untreat
gets
it,
worse.
and you reach beyond
I
the
love it.
6-week
I love
mark,
this.
this
Yeah.
turns into postpartum psychosis
Yes.
for both
It
genders.
gets
Yes.
worse.
Go back to that
Worse.
again.
Yes.
Go back. Y'all got to let us savor that, baby. Y'all got to let us savor that.
Come on.
So you said something about 6 weeks.
If it goes beyond 6 weeks, it then shifts into the medical term of postpartum psychosis.
Tell them what that is.
Postpartum psychosis is a mental disorder.
Mhm.
Wow.
And so, yes, a man or a father that is raising a newborn baby can develop a mental illness based upon the postpartum.
A serious mental
It's very
illness.
Go
serious.
for it.
You lose touch with reality.
Yes.
If I could just get analysis or
Take your time.
comparison,
This is to help the people.
this is something people aren't generally familiar with, psychosis, but people
Yes.
are more familiar with, maybe they've heard of schizophrenia or
Yes.
bipolar. When someone goes into psychosis, they lose complete touch with reality. They may have delusions, hear voices. They really, really suffer, and they don't know what's happening around them.
Wow.
Difficult to reach them.
Yeah.
So then you go into a situation where they're in big trouble. You're going to need professional help,
Yes, ma'am.
medication, support systems are very
I
important.
love it. I love it.
So good.
I love it. I love it. Oh no, I wasn't stopping you guys.
no.
And also, too, that can turn into suicide ideation.
Yes.
Wow.
And where that comes from is when you start not thinking that you are a good parent, you're
Mhm.
thinking that your child will
Absolutely.
be better without you.
Wow.
Yeah,
And this
yes.
is all stemming from postpartum
Mhm.
depression. So you begin to think that. So yes, that's a point where you really need to be open about reaching out and getting help. And a lot of times women or men may also be ashamed
That's
of
good.
feeling that
That's
way.
good.
You know,
Shame
when
is
they're
huge.
ashamed,
Yes.
they're thinking that, oh, I'm in a bad place because I'm not recognizing the fact that I've got a new baby. Most people with a new baby are excited and happy, and they feel like if they're not excited and not happy at that moment, that they're feeling
Something's wrong.
ashamed that
Mhm.
something's wrong.
Mhm.
And it's nothing to be ashamed about
I
because
love
a
it.
lot of people really go through that.
Yes,
They really
yes.
deal
it's very
with it.
common.
And yes, it's very common, and they think that something's wrong with them when it can stem from
Chemical
your
imbalance.
chemical imbalance with your
Right.
hormones being dropped. Your hormones are be low during the time that you're pregnant, so your hormones are out of balance. So that's where you have all those crying spells and
Mhm.
very emotional. So yeah,
You
so-
good. I do want to ask a question.
Mhm.
There is a question coming in, and she says, are women that battle with PPD more likely to battle depression in their later years?
Yes.
Who wants to take that question?
That
Yes.
is a yes. That is an absolute yes, but it does not mean that you are tied to that diagnosis. And so the earlier you seek treatment,
Yes.
the better outcomes that are there. And that's science, that's research, there's statistics behind it. You just want to seek treatment right away. Postpartum, also, let's look at that term just for a moment. It simply means how Miss Brenda Ward said, it means after giving birth.
Mhm.
Your child can be 18. You
Come
have
on with
given
that.
birth.
Yes.
And so if you're struggling with depression, go seek help. It's
Yes.
okay to just seek help from somebody. You may not find solace in your immediate circle
Mhm.
or your spouse or whatever. That's why there are therapists and counselors here to give you that
Yes.
unbiased support that
Wow.
you need.
Yeah.
So just keep in mind, postpartum simply means after you've given children. This can also affect people that are grandparents.
Yes.
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 And it's interesting, couple of things. I wanted to note what you said about shame,
Mhm.
also guilt,
Yes.
Mhm.
because you are
That's
thinking, I'm not a good parent, like
Yes.
you mentioned, and you feel guilty.
Yes.
And guilt and shame is another precursor of to mental illness.
Mhm.
Also, not getting enough sleep.
That's
That's
good.
key.
That's
That's
deep.
key.
When it comes to not getting enough sleep, I don't care if it's postpartum. I don't care if you're just a regular average
Mhm.
person. Sleep deprivation is a precursor to mental illness.
Wow.
Yes.
And you said it's a little loud, so you grab
Yes.
that.
Sleep deprivation
And
is
tell them what that is.
not getting enough sleep. Your body is shutting down, your brain chemistry changes, and you cannot function.
Mhm.
You cannot function. It causes suicidal ideations, depression, anxiety. It is a precursor to true
Wow.
mental illness, not just sadness,
Yes.
not just frustration, but true mental illness. So mothers don't get much sleep. Their hormones are low. And then,
They
that's-
can't
yeah.
focus.
Can I?
yes,
You want to
jump
ask
in,
a question?
jump
You want to go ahead and jump in, then I'll come back and ask that question.
I was just going to say what sleep deprivation also looks like is
Good.
scrolling through your phone in the middle of the night,
Mhm.
sitting on your tablet in the middle of the night.
Yes.
Having the TV and movies on in the middle of the night. A lot of people also overstimulation because you never bring your brain down. That's what happens. And so, just wanted to give that real world.
Yes.
What does it look like for you? It could be, I used to go to bed at 9 p.m. Now I'm up at midnight, 1, 2 o'clock.
Yes.
Or I used to get up at 7 a.m. Now I'm up at 4 or 5 and working out. So sleep deprivation means you've changed your typical sleep pattern, your sleep cycle, and have replaced it with something.
Wow.
And then now you've opened the door, yes, for suicidal ideations, but the biggest type of ideation that happens with postpartum depression is homicidal.
Yep.
Come on.
And very
Especially in
often
men.
with the men, but very often both the men and the women, they want to harm, if not themselves. That's suicide. Homicide means you want to harm the baby.
Yes.
Wow.
I'm going to shut down for that.
Oh no, that was good. There is another question, and if I don't see your question, please throw it back again for me. That's why y'all can see me. I don't have no problem getting up and coming in front of the screen. I will do that.
Yeah.
So I saw another question that was very powerful, and I want to make sure I'm pronouncing your name. It says Shell Walk. She said, "Can an adopted mom parents battle with a form of PPD?"
Absolutely.
Yes.
Yeah.
Yeah.
Okay. So absolutely with that. Go ahead, go for it.
Some may say, well, if you haven't given birth, then and it's hormonal, then why are you having problems? In close proximity, there's called pseudo symptoms.
Wow.
So it doesn't necessarily mean there's also external factors.
Yes.
Like we talked about the child not sleeping and keeping you up or feeling inadequate or just other financial problems. It could be all external factors, marital problems, not having enough support, worrying about how I'm going to make it.
Yes.
I don't know what I'm doing. I have nobody. So external factors also contribute. That's why it does not have to be coming from your womb for you to experience this.
Awesome. I like that. And you guys pretty much answered the question. Is PPD is not my fault. Is it their fault that they experience a PPD? Or any mental disorder, matter of fact? Can we address that?
No.
No.
I'll say any mental disorder is, like she said, a symptom. It's not really who you are.
I love
It's
that.
the thing, the external
It's
things
not
that
your
are happening
identity.
to you.
Yes.
Yeah.
Yes, there are physiological things that's going on in your mind, but there are, like you said, external things that are, contributing to that. Your environment can contribute to that.
Yes.
It's not just your body; it's the person you're talking to. It could be yourself, what you're telling yourself.
Yes.
So that's a big thing. Also, that also contributes to psychosis as well.
Awesome. I love it. Anyone else?
Well, I just wanted to point out too that the chemicals in your brain switch
Oh, wow.
based on your environment, like Ashley said, who you interact with, how you speak to yourself. There's cortisol, there's dopamine,
Yes, ma'am.
there's different chemicals that will, serotonin, that will decrease.
Yeah.
And if you don't have enough of that, it's difficult for you to function. You're always tired, you're irritable, and you don't have control over that once it gets past a certain point.
Yeah.
And then what we do in therapy is teach you how to cope, how to do things to get your levels back up. Sometimes we use medication to help you to take the edge off so you can do the work and learn the skill set so that you don't put your brain back in that position again. And it takes time, it takes practice, but it can be done.
Yeah. Well, I have a question for you guys. And if a person is, a mother is dealing with PPD, right? But they're struggling with breastfeeding. So where did that come from with them struggling with breastfeeding because they're having a challenge with bonding to that child? What would we say, or what would be the advice for them?
If they're struggling with bonding, typically go ahead and bottle feed.
Yes, I like that.
It's okay. Do not feel guilty. Medicine will say one thing, but you have to have this individualized plan and be okay with your current situation.
Yes.
So you may want to breastfeed, you may have to build back up to that, but right now mama has to take care of mama.
Right.
And you can't take care of the baby if you don't take care of
Come on,
self
with
first.
Your own
That's
oxygen
it.
mask.
That's it. And here's the thing with breastfeeding.
So have me speak in tongues.
That's true.
Say you have to stop breastfeeding because honestly, what if the baby's in danger in your arms like that, or something's
Right.
bothering you?
Yes.
Let's keep it real. We're talking about postpartum depression. If you have to bottle feed, that milk is still there for at least a year. So if you get out of that depressive state, you can return to breastfeeding if you and the baby choose. If you might try to put the baby back on, the baby say, I don't want it no more. And that's okay. But don't beat yourself up. Take care of you first. Just like Dana, when you're on a flight, they say put your oxygen mask on first.
Yes.
You have to, because you're taking care of a new life that is fully dependent on you. So take care of yourself.
So powerful. Go for add to it.
When you're breastfeeding a child, or even when you're in close proximity, they can sense what's going on. And you actually pass the anxiety, the strife, the strain, everything. It's not just coming through your milk, but it's coming from being close to you. They understand your heartbeat, your tone of voice, if you're tense and you're, and they pick all of this up, and then that transfers to them where they end up with anxiety. They end up crying all night, and it's worse for you because now it's like, okay, I have this baby that just won't stop crying, that's always discontented, but you don't realize that he's picking it up from you. So you have to get yourself straight.
I one thing that I do want to add to that, because a lot of mothers are now coming, and it's okay, they want to breastfeed, right? But what you can't do is pump.
Yes, you can.
Yes, they still get the milk.
You can still pump, because most of them are like, oh, I think it's more nutritious. I think it's more healthy for my child, which it is, right? But it's okay to pump and put, that milk in a bottle, right? And then I know there's a life shelf that you can put that in. I was talking to one of our other therapists the other day, and she was sharing that you can even freeze it. So that's another thing too, that you can actually still breastfeed, right? But you can also pump. Now you guys tell me what you think about this, right? I favor the pumping, right? Because then that way, if the mother needs to go out and do self-care, like getting the nails done, I'll call and say, hey, let's go get some to eat. I'm big for that, right? Or just want to get up with the girls. The baby is still getting what they need.
Yes.
And you are also getting what you need. So what you guys think about that?
Yes.
100% agree.
Yes.
And if you go out, you don't have to pump because your body's on a cycle. It knows when it's time to feed. So you're going to have to pump. You're going to be all wet if you don't.
And so definitely got to pump. Go for it.
I was going to say.
But that's like you used to breastfeed, right?
Yes.
I did too.
Me too.
I was going to say as well.
And she did a good job.
The baby, your body reacts to the baby sucking. So like if your body's not. So going back to kind of what you said about the baby feels it. If the baby is not like latching on, if they feel the anxiety, your body is triggered when that baby is, sucking and doing all that. So if they have anxiety because they feel your anxiety, your body's not going to generate milk anyway. So it's important. So that's why I do agree with the pumping, because it's like your body's in a constant flow.
Keep it stimulated.
It knows like, okay, I'm doing this. I don't. It's like mechanical almost. Versus,
that's good.
With the child. Remember, you release that oxytocin as well. So not only do you get it, but that baby gets it as well. So your body reacts to both. It's a reciprocal thing between you and the baby.
Yes.
You want to share?
Well, she mentioned oxytocin. That is the chemical that bonds your child and yourself. So if you're stimulating your breast by pumping and you're getting that release of oxytocin, even though you're not holding your baby, you're still bonding. Because that chemical is being released in your brain, and the more it's released, the more you'll find success in bonding with your child.
So audience, let us know that you got that, because they both said something very, very powerful, and that your body's going to still be bonding and you're still releasing that chemical in your body. So definitely want to hear from that. So y'all ready for us to go just a little bit deeper? I'm going to ask, and first Dr. Delandro, and even if what's your name again? Even if Ashley, because I am aware, that Ashley was breastfeeding. So are you guys open enough to be honest? I think me and you had a conversation that you personally dealt with PPD. So talk to us a little bit about that.
Absolutely.
So we okay with being transparent, right? So talk to us about that, because somebody on there, even though we are therapists, right? And yes, we have the degrees behind our name, but we have experienced some things as well. Definitely experienced some things as well. There's a question can you talk about doulas that, oh, okay, I like that. Let me read that. Hold on a minute, guys. Let me pull up for y'all tell your testimony. It says, can you talk about doulas that assist after having a baby? That's good.
There's a doula on the line, Rochelle Walk, that she's also asking
Rochelle, let us know. Put it
Certified
out there. Say, I'm
licensed.
here. I'm here. So yes, talk about that.
Yes, so doulas are amazing because bottom line,
That's
you
good. I
need
like that
help.
question.
You need help. And so too often in our society is you got to be this independent person, and you also have to learn to be okay being vulnerable.
Yes.
And so again, the key again is asking for help. We need each other.
Yes.
I see Rochelle just responded. She said yes, she is a postpartum doula, and so there's a career out of this because it takes a village. It really does. With that one little baby, but also for the mama, for the daddy, for any siblings, for the grandparents. The doula is there to assist you with that sleep deprivation.
Yes.
They're there to assist you with breastfeeding, all these key components that are needed for motherhood and fatherhood. So yes, doulas are amazing. Just like if you want to have your house clean, a doula's not going to clean your house, but I'm just saying you can get somebody like a cleaning company.
Like baby sis.
Yes, but they can help coordinate things with you. It depends on how far in services they go, but they're there to just help you as you ease into parenthood.
And she said something so key. I'm just going to touch it and run back out. It's okay to be vulnerable, all right? Because being vulnerable, it allows us to get the help that we need. I'm going to drop that and come back later. I think we're going to do a live on that. The importance of being vulnerable, right? Because we have been taught so long about not being vulnerable, but there is so much is good and danger with that, right? So it's okay to be vulnerable. It's okay to say I need help. It's okay to say I don't have it together right now.
Good.
It's okay not to be okay.
Yes, it's okay not to be okay, right? I love that, and that's one of the models that we live off of. It's okay not to be okay, right? So let's dive really back into it. I don't see any more questions. They said the doula said we do like housekeeping too. Awesome. So Dr. Delandro, take us into when you first, now you know it because of the education that we have, right? But take us back to when you was experiencing or having PPD.
Absolutely. So looking back at it, I had experienced depression throughout high school.
Right.
And so entered into marriage, got pregnant with our first child, and we're talking almost 18 years ago. And so healthy pregnancy, healthy delivery. The day that I got home from the hospital, I sat on the couch, the baby's there in my arms, and I just began to boo-hoo cry out of nowhere. So I thought. And so I just had these continuous crying episodes. And then this paramount amount of fear just rested on me. And and again, that's still very natural. Is what am I supposed to do with this new little person? And so, but I realized that a few days had passed, and I realized I wanted to hurt the baby.
That's good.
Although extremely in love with my child, I'm going to keep this 100% real.
That's it.
I remember I wanted to just take him and toss him into a ceiling fan. I remember I just wanted to throw him away.
Thoughts.
And the thoughts were so intrusive, but I'm looking at him like, but I'm in love with him. I couldn't understand what was wrong with me. The two didn't connect. I was happy to be a mother. I knew I was ready to be a mom, but I wanted him hurt for some reason. It was just weird. And so the very first thought of hurting him, I called my mother. I called my husband, and I had a great support system. So support system is also very key. That's why I said reach out for help. You may have to develop your support system, but everybody on this panel and from Virginia Therapy Services is ready to help you. You are not alone in any circumstance. And so I called my support system, and along with my sister Shakita, I got to shout her out. My mother, my sister, and husband then had to work around the clock to not keep me alone with the baby until I was psychiatrically stable again. So there's a difference in psychologically stable, psychiatrically stable, emotionally. But what happened was it kicked into, for me, postpartum psychosis. I began to experience the hallucinations. I began to experience the delusions, and they all lasted for almost 2 months. But again, that's why I'm so big on understanding postpartum psychosis.
Yeah.
I thought I was okay, y'all. No, I was sad.
Yes.
I was sad before I got pregnant. I was sad during the pregnancy, happy to have the pregnancy, but still sad for other life reasons.
External
And then
factors.
again, external factors. Thank you. And then again, very sad and hormonal after I gave birth. Didn't know what I needed to do.
It's a combination, right?
Absolutely. It was a combination of everything, but my biggest key was support. I went to see a psychiatrist. Y'all, the psychiatrist laughed at me. He said, it is nothing wrong with you.
Oh.
I said, but I'm hearing voices. I'm not going to go into the prophetic piece, but I was hearing. Because when you give birth, you're wide open.
Yes.
But that's a
That's
whole
good.
different
That's a good
thing.
one, April.
That's a whole different
That's
thing.
good, April.
And so what's in you is going to come out when
Yes.
you give birth. And so, but again, even the
That's good.
psychiatrist laughed at me, but he commended me. He said, you're so young and you knew to come and get
ask for
help.
help.
That's the key.
I didn't even get prescribed medication. He put me in weekly group therapy
Wow.
with other women that had postpartum depression.
Yeah.
And I was in there for a year. I got chills thinking about it. But I was in there with these women for a year. And they were struggling with depression before they got pregnant.
Yes.
They were struggling with schizophrenia during pregnancy. We all had different life walks, but it was still support. So the two key elements that I mentioned were reaching out for help, but I had support at home. The psychiatrist himself sent me to a support group.
That's good.
And then after I left the support group, I ended up in support with individual therapy for another year. So I learned in all of this, did y'all know that postpartum symptoms can rest in your mind
Come on.
for 7 years
That's why I was waiting.
after you give
That's what I was
birth?
waiting on.
So imagine you have a baby and then another baby and then another baby. You have restarted your psychological
Restart the
clock
clock.
and
Yes.
your hormonal
Yes.
clock. And so that is what happened to me. And I had 4 children and all of that good stuff. And no, I didn't experience postpartum after each child. I did experience it with 2 children. But because of the first one, that pillar one, I knew what to do when I saw it again early on.
Right.
I ran to the psychiatrist. He said, if you don't stop coming to the psychiatrist, you just need therapy, April. I was like, give me some pills, but you don't, your circumstance will be
Depends on
yours.
you.
Yes.
If you need medication, take it. Discuss it with your doctor if it's safe to take the medications and still breastfeed. Follow whatever the medical or psychiatric plan may be. But again, it's no shame in it.
Wow.
What you think of me is none of my business. And I'm here to testify and help the next generation or the next woman understand.
Wow.
Can I ask April a
Yes,
question?
go for it.
Yes,
Ask
ma'am.
her.
April,
Yeah.
what is the difference between the baby blues?
Mm-hmm.
Because that's a thing.
Yes,
Yep.
it is.
Yes, it is.
How do you tell the difference between that,
Yeah.
which is natural, and postpartum depression?
Absolutely. The time frame. That's
That's
it.
good.
I should just said it.
I
It's
didn't
just
go
the
for it.
time frame.
Yeah.
So baby blues, I think is literally 9 out of every 10 women experience baby blues.
Right.
So about 90%.
Mhm.
Versus
Yes.
postpartum depression, once you hit the 2-week mark and then the 6-week mark, that 6-week mark is key.
Yes.
It's very key. So it's really just the timeline of it. The symptoms are the same.
Yes.
So you're still battling kind of moments of sadness, feeling overwhelmed, irritated, for men, angry. But again, the timeline is the same maternally or paternally.
Right. That's good.
But baby blues, you'll hear that a lot. Especially you can actually, one more key element,
Take your time.
baby blues starts like after the feet came out of you
Yes.
immediately.
Mhm.
Versus postpartum depression doesn't set in until about 2 weeks after the baby's been
That's right.
born. Those are the 2 key elements.
Okay, awesome. Somebody said, thank you for being vulnerable. Thank you for being vulnerable. And it's very helpful. I have a question, and I think I'm also going to address this to Dr. DeLandro, right? We may have somebody listening today, or we may have somebody come back and listen.
Yes.
I know that I'm dealing with PPD or postpartum depression, but I'm afraid they may take my baby.
That's a good one.
That is a very good one. So
Oh, wow.
let me back up because I heard about this as well in one of the groups.
Mhm.
They cannot take your child unless there is a consistent concern for the overall safety of yourself and the baby.
That's right.
And so, yes, you can express, oh my goodness, I'm scared. I thought about hurting my baby. The only reason they didn't take my son from me is because I had a support system.
That's the key.
I had a support system.
Mhm.
Had I not, I probably would have willfully gave him
Yes.
because I was so afraid and I wanted him to live. That's how
Okay.
deep it was. I wanted him to be safe.
Yes.
But they can, yes,
Mhm.
they can take your child from you, but they're not going to do it to the extent. And when we say that they can, we're talking about Department of Social Services. And typically, Department of Social Services, let's think of social goals, is to reunify families. They want the family to stay together. They want the baby to stay with the mother. But if you can show I am actively working
my
on
support
this
system.
and I have my support system, there's nothing to
That's
worry
all I
about.
want. Yeah, that's all I want.
Mhm.
Yeah, so you want to ask me?
I was just gonna say mine was the complete opposite of
Okay.
yours. If you wanna,
That's
Mhm.
good.
Fine. Go for it.
Talk about it.
I didn't ask for help. I
And
didn't
did
know.
not speak a little louder.
Put the mic
I
That's good
But
though.
this is good though.
Yeah.
I shut down.
That's
I didn't realize it at first, and even for me, because I was already afraid because
That's right.
I was already going through a transition in my life already. But I just had a miscarriage a couple months prior to, so I was already fearful of like, oh my God, I don't want to lose my baby, and I had complications, so it was always that, oh man, like what's going to happen. So then I already was battling with depression before, so then
Anxiety.
yes, anxiety really bad.
Mhm.
So, I went through these things. So when she came, it was just like, okay, I threw myself into it. It's just like, okay. And I also felt like postpartum is another thing too. I felt like nobody else was safe with my baby but me.
That's
another
good.
symptom.
Yeah.
So it was even with her own father. Like
That's
it was
good.
like
So
I didn't
good.
trust him. I didn't trust anybody. It was, this is my baby. This is what I'm supposed to do. I'm supposed
Obsessive
to breastfeed her.
behavior.
Attachment.
Yes, trying
Say it
to-
one more time. Excessive behavior.
Excessive attachment.
Excessive
Yeah.
attachment.
Go for it.
Yes, and it was like I wanted to, keep her safe at the end of the day. And then, I breastfed her. So it was like, and then what I ended up doing, and not unbeknownst to me, is that I got her tied to my breast, so she didn't want to go to anybody.
That's right.
So then it became a point that I want to go to work. I want to do these
And
different
you
things.
couldn't.
I couldn't. Because I was
That's good.
I had,
Yes.
boxed myself in a sense.
Yeah.
And
That's
then
good, Ashley.
when she stopped breastfeeding, then it was like, oh, well, she doesn't need me anymore.
Yes.
So then it completely switched
That's so
to now I'm
good.
like, I'm not good enough for her.
That's
Mhm.
good.
That
I
starts
can't-
with something.
I can't, I can't function.
Cognitive
What am-
distortions.
Yes.
There
what
we
am I
go.
here for?
I'm
And
sorry.
even
And that was it.
We saw it. Y'all, these are church. These are church therapists. So if y'all hear involved in speaking in tongues and all of that,
April,
and how they boosted each
That's
other
good,
up,
though.
that's just
good.
the church coming out, Anna. But go ahead, Ashley.
And the crazy part is I had a great support system.
Yes, you
But
did.
I was in a house
You
full
wouldn't
of
use it.
people
Yes.
that were there for me, but
Yes, they were.
I felt so alone and couldn't even see them.
Yeah.
They were doing things. They were there, but like in my mind, I was so distorted in my mind that I could not see them. And what that looked like is
Wow.
me, sitting in the room, blinds closed, doors closed, not wanting to come out, not cleaning up, couldn't even get myself together, didn't even
That's
know if I
it.
wanted to take a bath or not.
That's
that
good.
day.
That's
And
good.
It took a lot just for me to get up.
That's
I
good.
knew I had to take care of my child, but it was like, okay, that's pretty much what got me out of bed. But that was the only thing. Crying yourself to sleep every night.
Mhm.
It's, like I said, postpartum can look like, again, not cleaning yourself up. And that's real. You don't have to feel guilty about that. That's
I
real.
love it.
So it even got down to the point that I felt like, okay, she doesn't need me anymore. So unbeknownst to my family, I had kind of vetted them, like, well, who she's going to go to if I'm not here.
That's right.
I had got to the point of suicidal ideation. I didn't want to hurt her, but I don't even know if my sister's on here, but I had a conversation with her. She didn't even realize what I was doing at that point. But it was like, okay, if something happened to me, would you take care of my child as if I would?
Start making
She didn't even know
plans.
that.
Yeah.
I had made a whole plan to do it.
Mhm.
But this is real.
But
This is
Yeah.
real.
and it's funny because I had set a plan and everything to do it, but the next day, my sisters called me, the village that I have. They called me and was like, okay, we're just gonna come and get you. And I didn't do anything special. All they did was come pick me and the baby up and just roll me around. And that meant a lot to me. And like I said, although, of course, of course they talked some sense into me, but it took them coming in and like, okay, you're this, you're okay, I've been through this. And it took me getting laid out, saying, okay, what's wrong with the
laid out part.
But no, that helped though to let me to bring life back into the situation, to let me know that you're the only one dealing with this. And so again, like what I was doing, and even with like my child's father, by me keeping her from him, like of course you gotta realize, you're hurting that child as well. So me thinking I'm trying to keep her safe, I'm harming her.
Yes, that's good.
I'm
Ashley.
damaging her at the time. So it's like, okay, you gotta do that. And then it's like, okay, well, you trying to take my baby from me? No, it's not that. It's so you can go out and go do what you gotta do and get yourself together.
Yeah.
And just, it wasn't even just about, me taking care of the baby. It was about me just wanting to do things for myself.
That's
Just taking care of myself physically.
Yeah.
So, and as a postpartum person, you have to take care of yourself.
Yes.
You just had a baby, and then too, like this was months. I had reached a part of psychosis because it was the lies I was telling myself in my head.
Yes,
it was
good.
Yeah.
That's good.
In my head, it was just I was like this. Nobody could tell me anything because I was just so I was.
That's
It was
good.
so bad.
Fixated.
Yeah, that's it.
Yes.
That's good.
And-
I have a question for you.
Yes,
Did you experience paranoid thoughts?
absolutely.
Yes.
Yeah. What did that look like?
It looked like oh, he's gonna try to take my kid from me.
Yeah.
Oh,
Yeah.
it looked like they don't like me. Oh, it looked like they think I'm gonna cry. They think it's a cry for attention if I try to speak up. It was a lot of things. Oh my goodness, yes.
Yeah, because that's one of the key things to
Yeah.
look for. Even in family members, if you hear a certain verbiage, if you're connected to them enough for them to be asking questions about if I'm not here, would you? If they start giving things away, then you can kind
That's right.
of pinpoint where their head is.
But see, I knew that.
Because you're a therapist,
That's
So-
that's good. I
so
like
you
that.
worked
knew that.
around that.
So I worked around it.
Yeah.
It hides
Yes.
well.
Mhm.
I do want to indicate that. I'm sorry to cut you off. I was just going to say it can hide very well. And so that reminded me how Ashley was checking out. I started to think and Google searched, how long is a jail stay? What are the sentences?
This is
I
good.
started to look it up and I was like, because I was just
Mhm.
afraid.
That's good.
Yes.
That's
And I'm like, so how much does an attorney cost to cover me?
Mhm.
And then once I realized I got to that point, suicidal ideation started to come to me. Towards me. So I started with
To
homicidal.
try to protect
Yeah.
the baby, I'll take
Yeah.
myself.
That was
the
it.
thoughts are
I
very
shifted it.
distorted.
But I
yes.
became comfortable
Yeah.
in the suicidal ideation because I didn't want to hurt the baby.
Mhm.
I then said, okay, I'm safe. Because then if I hurt me, I'll be okay. The
Yes.
baby will still be here.
Rationalization.
Yes.
Well-
Yes.
Go ahead, Sonia.
Well, I was gonna add too that because people don't. I was gonna add that people don't realize. She said a little louder. That also too events can trigger you to have postpartum because with me,
That's good.
I had a major loss that kicked me into postpartum depression. Whereas when my baby was like 8 days old and not knowing what to do with him. So when I lost my mother, it kicked me into postpartum
That's
Yes.
where I wanted to just, I just sit there and look at the
External
baby
factors.
crying and didn't know what to do with him. So I began crying.
Mhm.
So I cried all the time and didn't know what to do with him. And there were times that I was like, I just wanted to give him away.
Mhm.
Those were thoughts that like, you know what, you don't need this baby. You're not going to be a good mother. You don't know what to do with him, and then there were times, like you said before, where I literally thought about, okay, well, hey, I can't live anymore because, my baby be better off without him.
you. Yeah.
So I was planning to give my baby to my sister. So I knew that she would take good care of him. But they,
Some common thread.
but like you said before, when you have a great support system, because of that loss, I didn't know how to take care of my child. And then I felt like I couldn't live without my mother because that was who was taking care of my baby.
Wow.
So when that triggered, and to keep me stable, that's where my family did around the clock.
Yeah.
Because I didn't want the baby. The baby would literally be crying and I wouldn't even hear him. I would sit right beside him and didn't even hear him crying because my mind had checked out.
Yes. That's
So
it.
really I was like, okay, let me, I had really shifted. So if it had not been for the support of my family doing the round the clock and helping me, but back then I didn't understand what it was. But there are events that can trigger postpartum.
Those external
that can
factors.
kick you
Wow.
into postpartum. And it's not just with, like you said, with one child, but it was with both kids because then later on you have another child that you sitting there like, okay, what do I do with this one?
Yeah.
So yes,
This is really, really good. I am going to just kind of give some symptoms, and we are still just watching your comments. But before we go today, we're going to do it, virtual, where we're going to ask them questions, and if they're in that, and then we teach them how to add them up so they can see if they're actually sitting in postpartum. So I definitely want to leave with a great intervention tool with that. So we're definitely going to do that for you guys. But some of the feelings that they go through, and they have mentioned here, again, we are still watching to see if you have some questions. So one of the things that they all talked about was feeling depressed most of the day, every day, right? So they talked about that very a lot. Feeling shame, I've heard that. Yes. Feeling guilty or like I'm a failure, right? And I love it how each and every one of them were very transparent.
Yes.
Right? Because if you look at these ladies, they are extremely beautiful. They are extremely educated. And they put up with me. But the fact is, they're letting you know that they've been through or went through some stuff. So whether you're still experiencing it or not, but look where they're at today.
Yes.
Look where they're at today, right?
Listen.
Go ahead, go for it. Go ahead.
May I?
You may certainly can.
But God, somebody commented it on there.
But God.
But God, that's it. I just want to say, and if I may,
you absolutely can.
You may not have family supporting you. I can't stress this enough. Yes, the three of us have shared, we had our family to support us. And I know it can be lonely for someone that is a single mother, that may be a single father. Yeah. I just want to reiterate, call the number on the screen, reach out for help. Yes. If you are down like to your wits' end, it's okay to pick up the phone and call 911 and say, I am scared. I don't know what I'm going to do. And so not only that, there's also local resources for postpartum depression, for mothers, for fathers at the library. You don't want to stay in the house. You might be afraid of being, in the house alone with the child or whatever. You can go to the library. There's so many groups and activities that they offer, especially for new parents. You can also reach out for help back at the hospital where you gave birth and ask them, thank you, for resources. So I don't want you to ever think that you are alone. Again, you may be a single parent. You may be in a house by yourself. You may be disconnected from family and friends. That is okay to not be okay, but just know that there are resources. And again, if you just hit this point of no return, understand, just pick up the phone and call 911.
I like that. Definitely like that. Anyone has had something you want to add to that? Yes.
I wanted you to go through the symptoms, like you were, and then I wanted us to talk about the protective factors and the risk factors.
I love that.
So you kind of get a feel for who it has a propensity more likely to get it.
Okay.
And there also is prevalence among the African American and Hispanic communities. So I wanted to just touch on that.
We can definitely do that. So we talked about feeling shame, guilty, or like failure, right? Let's look. Another symptom is feeling panic or scared a lot of times. Feeling panic or scared a lot of times. So what I'm doing, I'm listing some of the feelings or the emotions that you may be experiencing. If not you, maybe someone that you know, a loved one, may be experiencing as well. Having severe mood swings. Having severe mood swings. Let me list a couple of more. Then we're going to turn back to these great therapists. Feeling tired all the time. Right? We don't want you to ignore any of these symptoms, right? And I hear this in my ear. I need you to understand that you are never a burden to no one. That is a lie. That's another symptom of another voice saying to you, I don't want to get on somebody's nerves. I know they're tired of me. No, ma'am. No, sir. Another one is eating a lot more or less than normal for you. Another one, which is a big one, is gaining or losing weight, right? And so again, even though we're talking about this, if it's not you, it may be someone that you know. So we definitely think it's important that you learn these symptoms as well. Hear me. If there is a pastor, preacher, teacher, fivefold ministry, this is so important because it is sitting in our church.
Oh yeah.
It is sitting in our church, and I don't want us to overlook this anymore. It may be that I just had a baby, and let's say 8 weeks went, and I don't show up to church. It's time to go find out why you're not showing up to church. They may say, "Oh, because the doctor told me to stay home for 6 weeks." Whatever it is, still check in. Right? Still check in. If you can't check in yourself, have somebody else to check in, right? And if they're not doing the activities like they used to do the activities, someone please definitely check in. Another one, and I heard you guys say this a lot, having trouble sleeping or sleeping too much.
Yes.
Right?
Having
trouble
sleeping too much is huge.
Or sleeping too much is very huge. Are you hearing me? And another one, and like I said, this is not all of it, but we're just listing some. Having trouble concentrating or making decisions. You heard us talk about this. Having trouble bonding with your baby. But I hear this one. Also having trouble bonding with your significant other.
That's it. Yeah.
Right? Where you feel like you can't bond in that piece anymore. Here's the one. I know April talked about it a lot. Thinking, and so did Miss Ashley, thinking about hurting yourself or the baby. Thinking about hurting yourself or the baby. Please reach out to a therapist, a trusted friend, your pastor, anybody that you know that you can trust, right? So that we can help you with those thoughts. And then thinking about, I think I heard you say this, suicide or killing yourself. We need you to know that this is so serious.
It is.
It's very serious. And we are actually taking it extremely serious, right? So Dana, I'm going to turn it back over to you because I know there's some other stuff that you wanted to add with that.
Okay, so I was just going to kind of do a collaborative thing. So there are risk factors. People who have the propensity or more likely to get postpartum depression. And then there are protective factors, things that you can put in place throughout your life to make sure that you are less likely to get it.
Yes.
And so I just wanted to get some feedback, especially those of you who have experienced this on that piece. So maybe start with the risk factors.
Yeah.
So we already talked about depression puts you more at risk, right?
Yeah.
Depression puts you more at risk. Financial problems put you more at risk. Like if you've had previous depressions or financial problems, if you have like marital problems, relational issues. If you don't have support systems, these things put you more at risk of having it. So when you deal with the protective factors, that's the opposite, right?
Right.
So basically, what do? You get support systems. You want to get help if you have financial challenges. Deal with the counseling. If you have marital problems or relational problems, things like that will be protective factors so that you don't get, like Anyette said, kicked into it, triggered into it. So I just wanted to kind of bring that into play.
I like that.
The other piece I wanted to talk about is African American women. There has been an increase in postpartum depression at 150% since 2011.
Yes. Please say those numbers one more time.
150% increase for African American women. And African American women are 40% more likely than Caucasian women to suffer from this. And Hispanic women also. I don't remember the stats.
It's not far behind.
So African American people of color, let's put it that way, have the bigger risk of getting postpartum depression as opposed to people of other ethnicities.
And I'd like to say that's a lot to do with, we have a problem sometimes with being vulnerable, is asking for help.
that superwoman syndrome.
Yes.
Yes.
Yeah.
I'm not.
Yeah, we're supposed to be able to handle it all.
But I need somebody to put up there. It's
That's a
okay
lie.
to ask
Yeah.
for help.
Yes.
Definitely, it's okay to ask for help. Anyone else before we go into our questions?
I was actually going to say this on the screen. Don't suffer in silence. You don't want to hide from what you're going through. And so Dana mentioned those are some pretty alarming statistics to see that there is an increase. And you don't have to pretend to be strong.
Right.
You can be strong in other facets of life, but in this moment, if you need help, just simply ask for the help. And I think it's also key that, especially for those that are in church or call themselves church leaders, to equip themselves with those protective factors. How do you answer someone that comes to you for help in this matter? So it's okay as a leader to say, I'm not exactly sure, but let me find the resource for you.
Right.
So at minimum, again, if you're a church or any other type of facility and you have where people are going to come to you for help and it's not really in your scope, that is okay, but find the local community resources available. There's so many resources available, but yet we still suffer in silence with this. We still don't want to ask for help. We don't want to be vulnerable. We want to seem strong. We want to be with these LLCs and have all these degrees. We want to sit here and be these CEOs and all. You can be all of that, but right now you need to be that baby's mother. Okay. And so you can have all these accomplishments, but we want you and the baby to stay alive. And so it's just key in understanding what's really, how do you prioritize this? So again, we say ask for help, but where do you ask for help? You may not even be in Virginia on the screen.
That's good.
And again, you can reach out to us and we'll try to help locate some resources, right? But again, you can go to your local church, and I don't want to keep going in circles, but it's just key how asking for help saved me and my baby's life.
Don't just try to suck it up.
Yeah.
And ask for help.
Ask for help.
Feeling some type of way, even if you feel a little bit, go ahead and ask for help. You are more important. You are more important than that job. You are more important than those symptoms. You have hope. Let everyone help you. And there are people that do want to help you.
That's true.
You know,
And
that
they're
was one thing
equipped
that
to.
I dealt with, that I thought that, again, that burden, thinking that you were a burden. No, there are people that do want to help. So just know that there are those people out there that, you know, even specialize in this type of stuff. Hey, so here you are. Call that number. Do not suffer in silence, and you are way more important.
I like that. You are way more important. You are priceless. I love that. I think Dane's going to say something. Then we come close it out with you.
I wanted to just say to the leaders, do not be dismissive. Sometimes we are encouraged to pray, to be strong, to push through.
You're touching my lane now.
To push through this. And we can't if it is a bona fide illness. It is not possible to just snap out of it, to push through it, to pray through it. Yes, you pray, but there's also actions that come behind prayer, you know.
I love it.
And so you have to pull together the resources, do the work, get the help, reach out. And just as leaders, don't be dismissive. As parents, mothers, fathers, don't be dismissive. Oh, everybody's had a baby. Oh, you get over it. You know, it's real.
Yes, ma'am.
And it's dangerous.
Yes, it is.
Yes.
I'm sorry, say that one more time. It's dangerous.
It's dangerous.
Yes.
Yeah. I love it. I love it. I love it. I love it.
Yes.
Miss Anya?
Yes. Just a reminder that you and your baby are both valuable. You are both valuable. You know, so many people think that, you know, well, I'm not worth it, but you are worth it, and so are your baby. You both are valuable. Yes, and you have to remember that. And it's okay to not be okay.
It's okay.
You know, and you have to be open about it. Don't sit and just keep stirring in it. But when we're giving you awareness tools and techniques, because we want to let you know that this is how you are aware of what you're going through. A lot of people don't realize what they're going through. But now with us sharing this, people are aware of, oh, wait a minute, you know, I'm in postpartum or I'm dealing with that. So when you realize that that is what you're dealing with, or any type of disorder or depression or anything that you're battling with, please, it's okay to be open and reach out to get the help that you need for you and your family.
So I love this. As I was going back over and looking at the questions, you guys hit every question there was.
Wow.
Right? And so to close out, I am going to come back again. Like one of the questions was, I have not been able to laugh and see things funny, right? Another question is, I have looked forward, I have having challenges looking forward into enjoying things, right? Another one is, I have been blaming myself. Another one is, I've been dealing with anxiety. Another one is, I've been feeling scared and panicky, right? So pretty much you guys have hit a lot of the symptoms, right? So I'm not going to read the questions like I said I was, but I am going to have each one of them. We're going to go back again because we're getting ready to close out. Again, thank you, everyone. Please share this. You can come back and take the notes later. You can reach out to us. And like Dr. Delandra was saying, if we're not in your state, that's okay. We know how to reach out to someone in your state, or you can do psychology today for your area.
Yes.
It's a great tool.
Yep. Do psychology today for your zip code. Matter of fact, you'll find all of us on psychology today as well. But whatever area you live in, whether it's New Jersey, whether it's New York, whether it's Georgia, whether it's California, wherever you live, definitely put your zip code in there. And as you look for a therapist, make sure you find one that fits who you are.
That's important. Good fit.
A good fit. You have to have a therapist that's a good fit. You have to feel good about your therapist. That is so key. You have to feel good about your therapist. You have to make sure that your therapist is listening to you and following what it is that you need.
It's a partnership.
Yes. It is a partnership. A lot of people I'm finding that want continued therapy because they're not really comfortable with their therapist, or either they haven't bought in or the therapist haven't bought in to them. And it's okay to keep looking for one until you find that right one. Is that okay? Because I just heard some of you say, "Oh, I had a counselor, but it didn't work." It's okay. I dare say something funny, but I leave that alone. Right? It's a relationship, like Ms. Dana said. It's a relationship, right? And so, ladies, before we hang up again, I do want you guys again. Let's give them each another intervention, even if you go back to the ones you had, that they can use to help them with postpartum. And the first thing I'm going to start with, it's okay to reach out to your doctor, right? Reach out to your PPD, right? Your personal doctor. I got to remember I'm on screen. Reach out to your personal doctor. Am I saying that right, y'all?
Yes.
Right. Oh, your PCP. What your PPD?
Postpartum Depression.
Reach out to your PCP, right? They can help you in reference to that. Just get started somewhere. So definitely want you to do that. Another thing too is find that support system. Find that sister, that brother that you can say, "Hey, I need to talk." Right? Go for it.
Well, basically, she took what I was
Oh,
going to
I'm
say.
sorry.
That's okay. But yes, you got to make sure that you have that support system in place, and also take the time for yourself. Do something for
Self-care.
you at least once a week. Do something that you want to do self-care. Be able to make sure that you have someone that is willing to take care of your child while you go and do something for yourself. There were times where I actually would take a day and just go sit at the water and eat ice cream or whatever I needed to do. But I would take that time away and just, leave my baby with someone that I trusted. But that was a way to do self-care, whether you go get your nails done, your hair done, or whatever it is. But take at least once or twice a week, whatever you need to do, but take that self-care time just for you to step away to refuel and then go.
All right, Miss Ashley.
let that grandmama or whoever it is wash that baby and go get some sleep.
And we will.
Get some rest,
I
huh?
like that's good advice.
Mhm.
Let grandma, let auntie now, let them take
Yes.
care of the baby. If that's a safe place.
Yes.
Go for it.
Get up.
Yes.
Just get up, bathe, brush your teeth. I'm so serious. Get up, bathe, brush your teeth, and go to the library. Or
Get
also
out.
schedule something in the future
Starbucks.
for you and the baby so that you have something to look forward to.
I like that. That's good.
I like that.
Mine is do not feel guilty. You are not to blame. This is a
Yes.
natural phenomenon, physical and external contributors. So do not feel guilty. Go ahead and speak up. Check in with folks that you love or that you can trust. It's not your fault.
Yes.
Excellent.
So again, thank you guys for joining here with us. If there's a topic that you want us therapists to have with you called Talk Therapy, please let us know. And we will be back next month talking about the next diagnosis or the next mental disorder that we have out there. All right? Narcissism. You want to come back and do narcissism?
Let's do it.
All right. They
Let's
want to
do
come
it.
back and do narcissism. So we're coming back next month and we're going to do that. So listen, take care of yourself
Yes.
and know that you're not a burden.
Nope.
Thank you for sharing with us your precious time. This is your pretty girl apostle. We'll talk to you real soon.